Hi, this is Gurpreet Singh, Interventional Technologist. Here I am presenting you a case of highly calcified LED. We hooked the wire, the vessel with a XB 7 French XB 3.0, and initially it was not happening. So we crossed a wire in the LCX, and with the help of it, we were able to hook the guide. And as you can see, the LED is highly calcified, and there is no marking. You can't really see the course of the vessel. So for that we tried multiple wires, but it didn't happen. So after many attempts, we tried Gaia second wire along with the micro catheter, as you can see. So as we tried to move forward, the wire was easily moving, but the micro catheter was stuck. So we tried in different positions, but it didn't happen. So then we used a Rotalink wire, and it crossed easily. After that, we used 1.25 mm per Rotalink Plus in order to remove out the calcified calcium. And after multiple attempts, we were able to move the burr. As you can see, it's a clear movement of the burr, and a nice result was obtained. Then we crossed another BMW wire because rota wire was there in early. So we removed out the rota wire and we started doing our pre-balloon on BMW wire. As you can see, it's a BMW wire in here, and the pre was done by 212 NC track balloon. After that, nice result was obtained, and pre-dilatation was done in the mid segment, in the proximal segment. After that, we used 2.7533 mm Zeiss prime. But before that, let me show you. As you can see, when we took the shot, there was a little dissection in the mid segment of the LED. So we thought, let's cover it as well. And earlier we were thinking to use a long stent in the vessel, but it didn't happen because the size mismatch was there. So we used 2.7533 from mid to distal segment, and then we thought we do go with the 3 mm stent on the upper segment, in the proximal segment. So we covered that dissection. Here it is with 2.75 Zeiss prime, 2.75 into 33. That was the length of the stent, and we covered the whole dissect area, and then we inflated it. Nice positioning and a nice result was there. And then we did the pre-dilatation of the proximal segment with the same stent balloon. Now as you can see, the distal segment is quite clear. There is no dissection. Everything looks fine. Then we covered the proximal part of the vessel with the Zeiss prime 3x18 stent, and we used guide liner for that because the movement was quite challenging. So we used a guide liner for that as well. And then a nice overlapping of these stents was done, and we inflated the stent quite properly, and it was a nice position. And I show you the final result. Here it is. Nice dilatation, and then here is your final result. As you can see, the proximal region as well as the mid and distal whole segment is quite nicely done, and the flow is nice. And we did the post dilatation with 3x12 NC track balloon, and with the proximal and mid, everything we did with the same balloon, and it was a quite nice result. The case was quite a bit challenging. Patient had visited to the multiple hospitals, and it was refused everywhere. So it was nicely done with the Rotalink device, and 2 stents were implanted, and here is the nice final result. As you can see, clear flow with no sign of dissection or anything, and that's how we did it. So thank you.